Hi, my name is Dr. Anna Baranowsky, and I'm really glad to speak with Dr. Gabor Mate today. I'm sure that you've seen so many times that connection between addictions and trauma, but I also know that one of the questions you're asking right now is, who are we really? And how that connects with this whole issue of how people get hooked into addictions and this whole complex issue of what comes before the actual addiction starts.
It's not that I've often seen the link between trauma and addiction. It's that I've never not seen the link between trauma and addiction. In other words, there's no addicted person who is not traumatized. And I know that surprises people because although it's easy to show the statistics that the more abuse, abandonment, loss there was in childhood, the greater risk of addiction. A lot of people say, well, I had a perfectly happy childhood, or I know of somebody who came from a perfectly good family and they still got addicted. What are you talking about? Mm-hmm. So what I'm talking about is the essence of trauma, which is not the external event, but the impact of the event on the individual. So trauma happens when we're overwhelmed by what's going on and be able to protect ourselves by somehow disconnecting from ourselves in order to endure it. And that can happen under conditions of extreme duress in the downtown east side where I worked for 12 years, Vancouver's drug area, North America's most concentrated neighborhood of drug use, actually. I've often made this point, I've never met a single female patient who had not been sexually abused. And all the men had been similarly traumatized in sometimes sexually, sometimes in other ways. But there it's clear what happened. A child treated like that has no choice. They're overwhelmed by what's going on, and to some degree they have to disconnect from their bodies and their awareness of emotions simply in order to survive.
Yeah, it's self-preservation.
It's self-preservation, yeah. So the disconnection is a form of self-preservation in the face of trauma. But people say, well, I didn't have that kind of stuff. So what are you talking about? And I still got addicted. Well, of course, again, if we don't look upon the trauma as the external event, but the impact of the event, then you can see how a simple dynamic like depression on the part of a mother will cause an infant to have to disconnect. Because the child's very personality and in fact the child's very brain is shaped by the interaction with his or her genetic makeup and the environment.
The emotional neglect of growing up with somebody in itself in a setting like that creates that trauma.
That's right. It creates the disconnect. So the essence of trauma is disconnect from the self. Mm-hmm. And from others. That's the essence of trauma. Even when you use the word neglect, it may create the wrong impression in the minds of some people because they might think, well, my mother never neglected me. And it's true. The mother never neglected them. It's just that the mother was as attentive as she could be. The problem is that when my mother is stressed or depressed, they cannot give the child that contingent communication, which is attuned and responsive. And for sensitive children, even the loss of that amounts to neglect, although it wasn't neglect at all. So what I'm saying is that we have to have a much more subtle understanding of trauma than simply bad things happening. Sometimes the trauma is in good things not happening, not in bad things happening. So that's the first point. And it's in the context of that relationship then that we develop our sense of who we are and who we believe we are. So we develop a set of beliefs about ourselves, which then run our lives. And that's why the question, who do you think you are? Who do we think we are at any given moment? Takes us right back to our actual reality, not to our imagined reality, but to actual reality.
The themes that run our lives, that weave into how we see ourselves.
That's right. And, that kind of understanding was present 2,500 years ago when the Buddha was doing his teaching, or Jesus, when Jesus was teaching, or when the Bhagavad Gita was being written. That there are underlying beliefs that run our lives that may not correspond to our ultimate reality, and that disconnect between what we believe and what is actually real is what creates our difficulties.
What are you doing right now to help people get in contact with that wound or essential hunger or theme that runs a person's life?
Oh, my technique is very simple. I call it compassionate inquiry. And it simply is pointing out to people whenever that disconnect shows up. So how somebody speaks about themselves, the way they might put themselves down, the way they might apologize for something completely trivial, the way they will speak about themselves. I just point out to people, okay, who's speaking right now? Where are you coming from? So we find out who we are by actually finding out who we're not. So my method is really simple, just to keep pointing out to people whenever they lack compassion, whenever they're disconnected from themselves. And that shows up all the time.
Right. And just a perfect example was me calling you at the wrong time this morning and then apologizing profusely, at which point you said very compassionately, with that kind of inquiry, I see that we get in touch with these places where we feel so insignificant, and how disturbing that can be if we don't have a way of finding our core again.
Yeah. And what's the feeling when you believe yourself to be small and insignificant? What is the belief actually? What is the feeling?
Right.
What is the actual feeling? I'm asking you to tap into your body. And what is the feeling when one perceives oneself to be small and insignificant? What is the actual feeling?
Mm-hmm.
Well, if I was huge
Mm-hmm.
and you were tiny
Mm-hmm.
and I had some power over you,
Mm-hmm.
what would you feel? What would the actual feeling be?
Oh, I would feel afraid or
Fear.
yeah. Mm-hmm.
Exactly. That's the feeling.
Mm-hmm.
So who do you think you are? Is you think you're insignificant, you think you're small, and therefore you feel fear.
Mm-hmm.
That's why the question, who do you think you are, is so important.
Yeah, and I mean,
And,
boy, what a nervous system disruption that is in that moment.
well, absolutely. And it has to do with the nervous system, and it has to do with certain nerve centers in the brain stem and in the brain. And physiologically, I'm very different from 1 minute to the next based on who fundamentally I believe I'm at that moment in terms of what is actually being triggered. And so if you ask me in a good moment, who do I think I am? I'll tell you, well, I'm 72 years old and I got this or that achievement or this or that set of relationships or this or that circumstance, and I feel confident and all that. And then a minute later, I think I'm somebody else entirely. So this is a constant inquiry. Now, the traumatized person, when the traumatic dynamics are being triggered, who do they think they are? Is they think they're isolated. They think they're unworthy. They think they're disconnected. They think they're incapable. Um, and the feeling that goes along with that, of course, is a combination of fear and shame. And so it's a moment by moment inquiry, actually, which, what does that come down to? It comes down to awareness. And not trying to get rid of anything, but just noticing that it's there.
In terms of somebody who has experienced extreme trauma in their environment, the people around them, and it's been chronic, and they faced it from many people over the course of their life, they really have felt small. They really have been afraid. They have had their lives threatened. This inquiry, how is that received?
Well, it depends really on the level of psychological readiness that the individual has. So you don't have to give everybody a lot of theory. You can just say, have you ever noticed that there's a voice in your head that says certain things about you? And what is that voice saying? Okay, so you've noticed the voice, and what is the voice saying? Well, who's doing the noticing?
Mm-hmm.
Who's doing the noticing is actually you. So that means that you're not that voice. You're not those messages. Because if you were them, you wouldn't notice them. So the one who's noticing, and so you work with the one that notices. You work with the one that's capable of being aware, and that's not a difficult message for people to receive.
Mm-hmm. And you're helping people to unhook themselves from the old belief systems, the old messaging that they've been carrying around maybe since they were 8 years old, or maybe since they were even younger. And when we come from a place...
You know what? The research shows that it could even be while they were in uterus.
I'm sure that's true, and I can see with the whole research around epigenetics that it could even go back through generations. And one of the things that we do with our work is we have people do traumograms and watch through the course of the generations how trauma has followed a family along. And where is that going to stop?
It always does. It's always multi-generational. It never begins just with the individual. And that's another way, by the way, of helping people, what you just described, is another way of helping people distance themselves, of recognizing that it's not them, because they see it doesn't come from them.
Mm-hmm.
They're carrying it. You might, in a certain sense, you might say that they're possessed by it. It's a kind of possession. Like Jesus used to drive out demons. People used to be possessed by demons. Well, what is this except a possession? Something possesses you so that you think you're it, but you're not. And what you're possessed by is the trauma of the people who came before you and who shaped your consciousness of yourself. So, the ancient discussion of possession is actually a psychologically very adept way of putting it. But as soon as you make it clear that you're being possessed by something that's not you, you're helping somebody establish that there's a them that isn't the same as that possession. So there's a them that isn't the same as that trauma. There's a them that isn't the same as the multi-generational pain that they're carrying. And therefore, you help people identify their true selves.
We are more than what we say to ourselves. If we can only find the way to become compassionate observers of our own storyline.
Yeah. Yeah, and very often people will have this double standard, and I keep pointing this out to people I work with, is they're very much more compassionate towards others than they're capable of being towards themselves. In other words, they will understand why somebody's acting a certain way, but when they act that way, they're very harsh on themselves. It also works the other way, is they can be very critical of others, in which case they're projecting exactly what they don't like about themselves onto the other person. And again, you can ask, well, who do you think you are when you're making that judgment?
Mm-hmm.
Who do you actually think you are?
We use an approach called thematic map and release to help people learn how to sit with a greater degree of compassion to these things that they say to themselves. You use compassionate inquiry. I ask them to ask these questions deeply to themselves, to sit, to pay attention, and then we walk them through some release exercises to help them reinforce this idea that they can watch, observe, be compassionate to, while being in a calm and settled state, kind of in layers, because I find that these negative things that we get caught in have so many layers to them. So with your inquiry, how do you get access to all those layers?
No, I don't know that I do, and I don't know that any one of us has the complete package neatly wrapped up and
Yeah.
in a way that we can just hand it to our clients. I do what I do, perhaps because that's what I'm good at. You know, and I'm sure the same thing's true for you. You do what you do in ways that are you're adept at doing, and I don't know that I get to all the layers. All I know is that it's very effective.
Can you, but when I talk about layers, I guess what I'm asking you is, do you see them as they unfold? Can you see the different layers? Because the first time you say to somebody, well, who is actually saying that negative thing? Who do you think you are? Peel back that. Do you see that in this compassionate inquiry that you're using? Do you see them peel back their own layers? Do you see people kind of looking more deeply and seeing where these negative thoughts come from?
Well, so the first thing is to take them into the body, to to return to the example that you offered of when you're apologizing to me this morning for something that was of no consequence to me whatsoever, a phone call that my cell phone received when it was actually off, so it in no way disturbed me. But if I'd asked you at that moment of apology or what's in your body at that moment,
Yeah.
at the moment of apology, when you're compelled to apologize, if I checked in you what's in your body at that moment, what's in your belly, what's in your chest, what's
Oh,
in your
yes.
throat,
Yes.
what might you have said?
I would have said that my heart was beating,
Okay.
my palms were sweaty, I had a sense of tightness in my chest, my stomach was fluttering.
Okay, great. That's right. Now, then if I'd asked you, how familiar are all those sensations to you? Or are they new? This is the first time you ever experienced it, or is there something familiar about them?
Oh, I think I know this feeling intimately. It is my body, and I kind of know that all of this is always possible.
No, but I mean, if I'd asked you how far does it go back, what would be
Oh, I
your
see. How far in my life has it gone back? I would say
feelings?
always, forever,
Okay, so what you're telling me,
always and forever.
right? So what you're telling me is really that at that moment you're being an infant,
Yes.
okay? Which tells me all I need to know about your infancy, and I don't have to. It's helpful, but it's not necessary for me to even get the details. Whether it was because of what I call overt trauma, or whether it's because what may be called developmental trauma, which is again overt trauma is when bad stuff happens. Developmental trauma is when not necessarily when bad things happen, but when good things that should happen don't happen. But it goes back to very, very early. So when you say how do you pay back the layers, you just take people take back you take people back to their bodies. It's
Beautiful.
right there. It's right there.
Yeah.
And then whenever moving forward, then whenever those same body states arise, they no longer have to believe that because all that happened in the present is you made a phone call to somebody 3 hours earlier than planned, but you didn't disturb anybody because their phone was off. That's all that happened.
Yes.
And you think of all the fluttering and the tension and the tightness and the heart beating, and it's got nothing to do with what happened, right?
Exactly.
Or,
Exactly.
that's the essence of trauma, of course.
Yeah.
Is that we go back to a time when we were overwhelmed by something and we couldn't handle it.
Right.
And that keeps showing up in the present. So when trauma is when we're overwhelmed in a way that affects us in the present, but also in the future.
And your compassionate inquiry and the way in which you hold that the way that you ask these questions, I mean, my experience of it is that it just comes with such a deep sense of respect and empathy, uh, being on the receiving end of it, having made the mistake, feeling so silly and unworthy, and then,
Well, no, let me stop you again. Sorry, Anne.
yeah,
Okay, I'm just working with you right now. Okay, so this is for the benefit of our audience here, right?
yeah,
But you're making yourself available for the work. So if that's okay with you, I'll
that,
interrupt, and I'll
yes,
do with exactly what I do with anybody else. I'd say again, there's no such thing as feeling unworthy. That's not a feeling. Feelings are I'm tired, I'm hungry, I'm sad, I'm angry. Unworthy is a belief. Who do you think you are? You know, insignificant is not a feeling, it's a belief.
hmm
And it's associated with all those body sensations that you identified, you know. So you just take people into themselves. You invite people to be themselves. And it's not a question of, and the word mistake that you made. You know, remember I said to you that my job is to interrupt you whenever you're not being compassionate. What kind of
with
mistake are you talking about?
myself,
Sorry?
with
With yourself.
myself.
Or with yourself. I have no doubt that you're capable of, in fact, you're incapable of not being compassionate with others, probably, at least in your professional realm. But what mistake exactly are we talking about?
Well, that's my point. I understand that I made a phone call at the wrong time, and for me that felt like a mistake, and it came with all the physiological things that we already addressed, which I
Yeah.
absolutely see and feel, and actually I'm feeling them right now because I feel that whole thing gets hooked in as soon as we talk about it. It's like the body is just so unbelievably powerful,
Yeah.
the way it holds all of it.
Well, you know that new book by Bessel van der Kolk, The Body Keeps the Score,
Right.
or Babette Rothschild, The Body Remembers, you
Yes.
know?
Yeah, good examples of how we always know how vulnerable we are at any given moment, certainly no matter what our professions are. And that doesn't, it doesn't really protect us from the feelings that we have or anything that might be unresolved or our essential humanity and our wiring.
Well, I find for myself is that I often hide behind my work as a way of wanting to protect myself from what's really going on inside. In other words, I actually use my status or gifts, if you want to put it that way, as a way of protecting myself from precisely that vulnerability. So sometimes being a professional um, can actually be a barrier towards uh, growth post-trauma. It's a way of locking ourselves in because we think that because we understand it intellectually and we can work with others based on our knowledge and our empathy, that therefore somehow it doesn't apply to us or somehow we've worked it out. And I see with, certainly in the medical field but in general in the helping field, I see all the time that people use their professionalism precisely as a way of trying to protect themselves from their vulnerability, and it doesn't work. In fact, it creates further suffering for them and for others.
As if
Certainly in my case, that's how it is.
as if we're able to skip a step as human beings just because we're
Yeah.
professionals, and that's not really the truth at all.
Yeah, and in my case, I think I can protect myself because I'm smart and insightful and with certain credentials, and I can do a bunch of things. I actually hide behind all that to avoid feeling the fear that's in me, the same fear that you described in yourself. That is very much alive in me as well.
So this is exactly the same. I look at trauma as a great human equalizer. I really actually don't think I'm any different than my clients. I have to work really super, super hard to create a world around me, to create an inner world that allows me to even do my work, because I don't actually think I would have been able to do my work if I haven't been very diligent, working hard all the time to make sure I'm well inside of myself and surrounded by good and healthy environment. And I do speak to a lot of professionals about compassion fatigue, and that's one of the things that I find is such a hard thing for professionals to offer the same level of compassion to self as you would so easily to other people.
Well, you know, I have a different take on what you call compassion fatigue.
Okay. Okay.
It's very much along what you just said. I just formulate it differently. It's not compassion fatigue. Nobody gets fatigued from being compassionate. It's lack of compassion fatigue. It's, in other words, you're fatigued by the lack of compassion for yourself. So it's that's what's fatiguing. In other words, two people can offer the same level of compassion to others over the same period of time, and one is fatigued and the other is not. What's the difference? The difference is that in the case of the person who's fatigued, there's some lack of compassion for oneself in how they approach it. In other words, they're ignoring something about themselves. Perhaps their body wants to say no to this whole thing. Perhaps they need time to themselves, but they don't take that time. So there's a lack of compassion, and that's what makes us fatigued. It's not the compassion that makes us fatigued. So the whole phrasing of compassion fatigue to me is, I understand what it refers to, but it hides something. It hides the lack of compassion for oneself. That's actually the source of the fatigue.
Yeah. Yeah. I can see that very clearly in a lot of the kind of people that I talk to and work with around that conversation. I want to just ask you one final question. Is there anything else you want to say about the work you're doing? I know that you're giving some public talks in Vancouver on Who Do You Think You Are, and Compassionate Inquiry as well, coming up in Toronto, I believe, November 2016, and in September 2016, you're doing a 2-day workshop in Ottawa, and you're focusing on some of the work with Beyond Addictions with Sat Dharamkar. Is there anything else you want to share before we're finished today?
Well, thank you for mentioning those events. And then one in Toronto will be specifically for therapists. You know, it'll be really just an immersion into whatever it is that I do, and over 2 days, and it'll be a real journey of self-inquiry that I'll be helping to conduct people on. Anything final? Well, you know, it's only that for me it's constant work as well. And I keep finding that life will keep reminding me of who I actually think I am. Underneath my beliefs and roles, I just keep having to find out, and the more I find out about that, the more effective my work becomes. So there's no final word for me, because it's just an ongoing. Speaking of layers, I mean, it's an ongoing lifting of veils. And I don't know that it'll ever end, but I think for myself, I also think for everybody else, it's constantly having to be open to that process in ourselves. I think there are some people, perhaps in this world, for whom the trauma is completely resolved. I'm not one of them. And I don't think that many are. So therefore, there's never any final question. There's just sort of a process that goes on and needs to, and blessedly so. And it's, from the perspective where I'm sitting today, I'm grateful for that. It's a very exciting journey.
Wow. Well, thank you so much for spending the time speaking with me about your view of, I guess, growth and recovery and being human. I just want to recap really quickly before I say goodbye to you today. First, you know, more than anything, let's continue having a conversation about who we really think we are, whether we're professionals or we have experienced massive trauma or we're struggling with addictions. Is this internal voice really the internal voice you should be listening to? And keep growing after trauma. Keep unpackaging, unfolding, getting in touch with the things that are happening inside of you and challenge where you can go and how you can grow. And I want to just thank you so very much for joining us today and helping me to understand who I really am as well. And also your beautiful work that you're doing in helping so many people grow and learn.
For more Ask Dr. Anna videos and information about post-traumatic growth and recovery, subscribe and like our YouTube videos at What is PTSD, or join us at previous video episodes in our playlist Ask Dr. Anna from the Traumatology Institute team.